Do you know how many subjects you are going to face in your whole MBBS course? Anybody tell me, please. 19 subject. In first year, 3. Physiology, biochemistry, and anatomy. In second year, pharma, patho, micro, and FMT, forensic medicine and toxicology. And in third professional, ENT, and preventive and social medicine. And in final year, you are going to face medicine, general medicine, pediatrics, surgery, gynecology, okay, skin anesthesia, psychiatry, and radiology. So 19 subjects within 4.5 years, and then 1 year internship. Every department 1 year will be divided. So this is just an introduction, and every day and every time you will face this topic. Okay, so very simple topic, but I am just give you an overview that first aid, as you are going to be a doctor in future MBBS course, then you will do specialization. So specialization is 3 years course, which you will going to do degree course, MD, MS. So nowadays DNB also there. So specialization is 3 years. You can choose any subject out of 19 subjects, and after that, if you will go for 3 years study, that will make you super specialist. Okay, so like MBBS 19 subjects, MD medicine, surgery, gynae obs, whatever, and after that in from super specialization, in some subject there is no super specialization, but somebody who did medicine, somebody who did physiology, somebody who did biochemistry, surgery, in from surgery they can go to super specialty in MCH, and from medicinal department like medicine, somebody can be cardiologist for 3 years course, nephrologist 3 years course, endocrinology, rheumatology. Okay, so there is lot of study in front of your future. So you decide how much you want to achieve. Okay, so today I will finish my class within a very short period of time, because this topic every day in life you will face. What is first aid? So first aid means first active intervention delivery. Okay, so like sometimes you heard that some doctor is in flight and somebody has got some heart attack. So then the doctor, flight management knows that the doctor is with them in the flight, so he will go there and he will give first aid medicines. Means not all the life saving medicine will be there, but you can do something with your bare hand. There is nothing, stethoscope, nothing. Okay, where you are a doctor, but there is no hospitals, there is nothing. So what you can do? Okay, so everywhere in a car or in a flight or in a train, there is first aid kit. Okay, first aid kit. After accident, first aid box is there. So preliminary treatment or preliminary intervention, maybe treatment not be given by you, but intervention you can do something na. As a doctor, lot of things, lot of people will expect some things, like snake bite, somebody bitten by a snake. Okay, so then as a common sense, as a layman, they knows that the where the snakes has bitten the man or female, so in the above part of the body they will bind and they will immobilize that part. Immobilize means there will be no movements, because if movement will be there, blood flow will be there, and the poisons will circulate in the blood very fast. So as a doctor, what you will advise? You can bind in the upper part of the body if the somebody bitten by the snake in the legs. Okay, in the great toe. You know the great toe? Okay, it's a great toe. You know anybody? So great toe means the part of the body. This area. This is the great toe. If somebody bitten by the snake here, you will bind here. The blood should not be go upwards. And by this time you will buy sometimes, and by this time you will send the patient to the hospital. Okay, and there they will get the definite treatment. But you have done something. So there is lot of things. Somebody in accident, okay, cut a body part. Okay, so now what you can do? You can go there. There will be a first aid kit. Okay, so then you can soak the blood, and you can give the Dettol wash, and you can bandage that area, and then you can send the patient to the hospital for the permanent treatment. Okay, so now I have given you a preliminary idea what do you mean by first aid. Okay, literature meaning if you search you can understand what it. Okay, I think so. So now we will go through some slides. Objectives of this class today: definition of the first aid, understand the key step of the first aid, to learn about basic skills of the first aid, knowledge about types of first aid, guidelines of first aid procedure, knowledge about first aid kit, explain the golden rules of the first aid, learn the principles of the first aid. And now this line, knowledge of the first aid kit. After now, if after 5 years later you are going to an MBBS doctor, okay, if somebody asks you that make a first aid kit for me, and you will put some cotton, some gauze piece, some Dettol, okay, some Calpols like fever medicines, like anti-vomiting medicines, like abdominal pain medicines. So you will make these things that kits after having some knowledge. So this is the main part, the knowledge. Like in the flight, whenever you are going to make the first aid kit, so then you will think that in the flight what kind of problem a patient can happens in the flight if somebody is having vomiting, because there is some air motions and air, and that is in the high pressurized chamber, there is no air connection from the outside, so patient's body can behave like in a different way. Out of 180 passenger, somebody can having some vomiting, so ga gulaচ্ছে, vomiting tendency feel hocche. So then you have to keep in your mind that that kind of problem can happen in the flights, so you will put some anti-vomiting medicine. Okay, so this is the knowledge about the first aid kit. When was the word first aid used? The term first aid first appeared in the 1878. Is a combination of first treatment, what I told, and national aid. In Britain, civilian ambulance crew were trained specifically for the railways, mines, and the police. Where there is no hospital can go there. You are working here, your hospital is here, but that hospital will not go to the wire place, not go to the railway accident tract. But you have to, whatever you can give, whatever you know about the first aid, you will do that. You will give that things at that time. Mobile silent कर लो सब कोई. So now you see, okay, this sometimes if somebody asks, and sometimes you are going to discuss with your friends that you know that first aid term when it has been coined and where It has been necessary. Necessity is the mother of invention. Everybody knows that. Okay. So during world war, their first aid is needed. So they made some kit. In the box they have put at some medicines, put at some essential salines, put at some fluid, put at some intracate. Intracate means some that is a needle which can you directly put in the veins, and through that you can give the salines, some medicines, some antibiotics. So necessary antibiotics you can keep. Okay. So all about the knowledge of the first aid. Friedrich Esmers, the founder of the modern first aid kit. From that times there is lot of modifications has been happened, and now what I am going to discuss, that is the modern first aid. First aid is an emergency care given immediately to the injured person. This is the definition. What I told you now, that is emergency care given immediately to an injured person. Not always the patient, not always the Bimar population, not always the diseased person. Is an injured person who just previously okay, well and good. So the purpose of the first aid is to minimize injury and future disability. Okay, if somebody in the road traffic accident fractured his some part of the body, as a doctor you know that immobilization is needed. If there is mobility, the fracture bone can pierce the muscles and they can come out of the body. Okay, so in that time you will say, I am the first aid manager and don't move that part of the body. You will fix it by any means. Okay, you fix it, and by stretcher that patient will go to the ambulance, and that patient will go to the definitive treatment area in the hospital. So your job is done. This is the first aid. So this is very important. In the America, first aid team is very active. They are having also CPR team. CPR means cardiopulmonary resuscitation. If somebody's heart has been stopped in the drowning means jole pore o dube jacche. Okay, in the pond somebody is not knowing the swimming, he has gone to the deeper part of the pond or in the sea. So in that cases he will intake some fluid in the water. Okay, like a car happens an accident and go to the river, and out of 50 passenger, 20 passenger is not knowing the swimming. 20 patients is not knowing 20 persons is not knowing the swimming. So they will go deeper and deeper. Okay, the first aid team will go there, not hospital. And at that time, if somebody's heart has stopped, you will push pressure on the heart. Somebody's heartbeat will come again. Okay, so this is the very important part. So there is lot of modification has been done. Okay, first aid team is there with the car. They are waiting in the America because they are developed country. They are having lot of money. They can spend lot of money in their health system. Okay, and 1 kilometer later there is a car with an fully aid of all the treatment. They are having all the necessary things in their car. CPR team is there, ventilator is there, mask is there, oxygen is there. Okay, okay. So actually, if I am telling something which you are going to know in your future after 1 or 2 years later, but I have to say it is today in this class. Okay, what is ventilator you don't know. Okay, what is nasal prongs you don't know. What is nasal bags you don't know. So but gradually you will come understand. Everything you will exposed. You have to know the normal saline, what is ringal lactate. Everything they keep in their kit. Whatever the things they can carry and they can give in the roadside, all these things comes under first aid. Okay. In serious cases, first aid may be necessary to keep the victim alive. very important, na? Very important. This point means the person which is severely injured, you have to concentrate on that person to save his life at least. Life saving is most important part, more than the limbs. Like হাতটা চলে গেলে চলে যাক, cut the hand, but make the patient alive if necessary. Okay. So again the definition: emergency care or treatment given to a ill or injured person before regular medical aid can be available. This is a picture. Okay, you are just doing a gauze piece and bandage, so you can do it in the roadside. Okay, just to stop the bleeding. If bleeding will be there, the patient will have anemia, patient will have cardiac problem, patient can die in the road. So at least you can stop the bleeding. This is the most important things to save the life. This is first aid. এই স্লাইডগুলো কি ওদেরকে সবাইকে প্রোভাইড করা হবে তো? হ্যাঁ, তাহলে তো ওরা পড়তেই পারবে না। You can have a note on these things. Okay, brief discussion about the first aid. You have to write 10 lines. Okay, definitions, what is the necessity. So you can make that note in your home, and just I am discussing broadly. So this slide you see, what are the three importance of first aid. In the time it takes for more advanced care to arrive, means ambulance is coming but it will take 1 hour, and for 1 hour you can't stay in front of the patient and doing nothing. You can't stay. You have to start your first aid. So this is first aid. To prevent medical condition from deteriorating. Deteriorating means, you understand what is deteriorating? Means खराब से खराब बदतर कंडीशन ना हो जाए, जितना हो सके पेशेंट को लाइफ सेव करने के लिए देना है. Provide reassurance. Okay, somebody is there, the ambulance is coming, the whole doctor team is coming, our stretcher is coming, flight is coming, air ambulance is coming. Okay, so you all of you are fond of cinema. Everywhere sometimes you have seen some war movies where in the fighting zone medical team is there, but they will they stay in a safe area where they will protected by the militaries, and injured militaries treated in that place. Okay, but somebody in their teams during where they can actually train for the first aid. They are all actually trained, and they brings the patient in the area where they has given they are having main area where there is protected. In the protected area they will bring. After that patient will send to the hospital for the definitive treatment. What are the 5 key steps for the first aid? DRABC. So how can you remember this thing? Dr. ABC. Okay, Dr. ABC. D for danger. Assess the situations. If there is fire, you assess the situation, bring the patient out of the fire and take her to a area where the fire is not there, and at that time first aid will be very fast. Rapid response. R for response. A for airway, B for breathing, C for circulation. Okay, Doctor ABC. D for danger area को recognize करना है. R for rapid response. A for airway. B for breathing. C for circulation. If you will read this slide, it will take 3 hours. Means, if I can give 3-hour lecture in this slide. Airway. What is the function of our airway? Anybody? Airway. What is your airway? Nose. Then glottis. Then trachea. And then lungs. Trachea will go to the lungs. All this is road. The oxygen will go to your lungs through the nostril, glottis, trachea. Okay, then alveoli. So airway is very important part. So A for airway. If somebody like earthquake is a disaster. So some part of the land slide into the chest of the patient and in the face and in the head. He is unconscious and his airway is blocked by the sand, stone, whatever. As a first aid team, they will go there, they will secure the airway. All the things which is in the mouth or in the nose, or somebody having some stone in the chest, in the lying down position, earthquake, patient is unable to take the breath. So you remove the stone from the chest and you remove the part of the chest from the problems. Okay, so first of all you secure the airway. If you can't secure the airway, then you put some oxygen by the ambu bag. So you have to know the ambu bag in future. Okay. Sometimes ventilator support. Directly you put a tube from the mouth, it will go to the trachea and directly it will connect it to the machines and it will give oxygen supply to the lungs of the patient. Okay. Then breathing. So airway and then breathing. Airway, you have cleared the mouth by your hand with the gloves or with some fork. Okay. Chimta. Okay. And after that, you will see the patient's breathing has been restored or not. And then circulation. What is the blood pressure? What is the pulse of the patient? If there is some bleeding of the patient, bleeding from the patient's body, then what you will do? Okay. You can give the saline, na? Patient has lost lot of blood. Now BP is going down. So in that cases, first aid team will give saline to the patient. Okay? Understood this slide? Next slide, Corona. Basic skill for CPR, setting a splint, stop bleeding in the dire situation are important life saving skill. What has been discussed now? Next slide. Oh. এইভাবে বুঝছি What are the type of first aid? So CPR. The term is CPR, that is cardiopulmonary resuscitation. You are seeing how this one hand is above one hand. Okay? One hand in the middle of the chest and another hand is above the hand to give the pressure. Okay? So this is very important. You see, those trained in cardiopulmonary resuscitation can help a victim of cardiac arrest to start breathing again. Bleeding. It's important to stop a wound from bleeding to prevent the loss of too much blood. Burns, choking, broken bones. Understood this slide? Now I have discussed everything. Earthquake, accidents, bleedings, okay, drowning. And if there is no breathing, you can start CPR to start the breathing again. And the picture is showing you where you have to put. And for this CPR, you will have some procedure skill classes. Okay? In the dummy structure, somebody will give you the demonstration. And then you will try, then you can understand. And once upon a time in future, you will apply this to a patient. In your peripheral posting, whenever your internship is there, 3 months, you will stay in the periphery, the very village area where the medical treatment is not available. You will be there and your first aid skill will be very important for you there. Okay? Compulsory 2 months peripheral posting will be there. That will be come under PSM, preventive and social medicine. Here are the 5 steps to first aid. Recognize the emergency. Does someone look like they are in trouble? First of all, in an accident, out of like in a bus accident or in a train accident or in an earthquake, not everybody will have injury. Those who are not injured, you side them out and keep them another area. But the person who is mostly injured, you have to give preference to him. That procedure is called triage. Very simple patient, very simple accident, very simply injured. Green, then yellow, tag. You can put a tag. And then red. Red means he needs most proper first aid. So you can do a triage and your team will be trained by you only. You will be the most highest qualified person in your team is an MBBS doctor. Okay? And all the person who are not the medical professional, but you will make them understand that brother, this procedure you will do in this way and you make you trained. I am telling you one time, you can make you trained. So CPR team, IB channel team, you can do, you will do the channel kore dao, saline ta lagate hobe. Do a channel and put in saline. Bas, your suggestion is there because you are knowing everything, na? Ask them question in case of the situation escalate to increase in the extent volume number to unconscious people. Unconscious people is always come under the triage color red. Okay. So anybody any time exposed with this term triage, no injury, green. He is okay. Moderate injury, yellow. Severe injury, red. There is a triage. Stepwards to other person and understand what is the situation of the patient. Three P's of the first aid. Okay. Clean the wound by gently running over it. So not every patient will have wound, but if the patient will have wound or the victim will have wound, you will actually clean the wound with the soap, special soap. Avoiding using soap on an open wound. Special soap, I told you special soap. Apply antibiotics to the wound, Dettol, okay, Sablon, lot of antibiotics which can you carry, you know that things. Cover the wound with a bandage, okay, you have seen the picture. With deep wounds, apply pressure, don't apply ointments, seek medical attention as soon as possible. Why apply pressure? Because if you will not apply pressure, the blood will not clot inside the blood vessels and the bleeding will continue. So bleeding continue, we can't afford it, okay. Read through these details guides on all 10 items. 3 P's are the primary goal of the first aid. Check the scene for danger, treating cuts and scrap, treating sprains. Sprains means মচকে যাওয়া ওটা mainly in the accident, road traffic accident, patients legs, patients limbs sprain. So in that cases you have to immobilize the area. Treating heat exhaustion, treating hypothermia in a cold area, like you all of the student, I think you have seen the Titanic. So in the Titanic film there is minus degree of the temperature. In that cases what you will do? In the first aid, anything, any intervention which will increase the body temperature, you will do that. Like in a roadside area, in a cold session, somebody is shivering with the cold, so you can give some kambal simply. This is the first aid. This is the first aid. Allergic reaction, somebody has an allergic reaction. Out of all of you, somebody any times undergone an allergic reaction? Nobody? Allergic reaction. In allergic reaction, if severe, the part of the neck, that is throat, swelling is there. Patient will suffer. Oxygen level will down. The swelling in the face is there. Redness of the face will come. So then anti-allergic medication you have give, that is called steroid. So you can keep hydrocortisone like steroid in your first aid kit. Very important medicine. Okay. What are the basic first aid procedure? Just see. You can put all this instrument inside your first aid kit. Gradually you can understand how to stitch the body after cutting. In future you will give the stitch to the patient body after giving anesthesia. Somebody will have surgeon, na? You wants to be a surgeon in future. So you have to cut the body, then you can stitch. So in the first aid kit you can put some stitch, some needles, some fork, by which you can take the skin and put the stitch, bind it, cut it, finish. So you can put this kits. So all this in this picture, the blur, but you can see from that area. This is thermometer, this is gloves, this is gauge piece. Okay, very simple things can make a very big first aid box. A basic first aid kit should include alcohol pad or antiseptic pads. Okay, like wet tissue. You have seen wet tissue. So in medical there is also some wet tissue which is having alcohol, 10% alcohol. That is an antibiotic. So you can put in the cut, in the wounds. At least for sometimes patient will get relief. By this time the definitive treatment will come. Then band-aids, cotton balls, Q-tips, elastic bandages, hot and cold packs, medical taps, small container of sterile water and saline spray, soup and hand sanitizer. And in upgraded and modified version in the America and in the developed country like Australia, the ambulance like big car is there. They will have ventilator support, BiPAP machines, ambu bag, everything. They can give you an hospital like support in the road. They will take the patient, take the injured person, take the victim in the car, and everything that they will have. They can keep blood product also. If somebody injured and lost lot of blood, they can give the blood transfusion in the car also. Simple blood. If they will know the blood group of the patient, they are having 4 type of blood group: O, A, B, and AB. Okay, so four blood group or blood bag they will carry for a single day. 50 accidents will not happen. At least 1 or 2 accidents happen. They can tackle it. Okay, so they can give the blood also. They will have normal saline, ringal lactate with them. They can give it to that. And as a doctor, you will be then master, and you will advise. So please do the line channel and transfute the blood with that speed. Finish. Your advice is like that. This very simple kit. You can put all this kit in your home also, but not for the bigger situation. What are the 10 items in the first aid box? Very simple. Plasters in a variety of different size, shapes, small, medium, large, sterile gauze. You will see in a second year what is gauze. I think everybody knows the gauze. If you will go to any medical shop, if you will ask for the gauze, they will give. There is specialized type of cloth which is made up of different type of tissues, and there is some antibiotic covering. Okay, so that is gauze, medical gauze. Triangular bandage also, crepe rolled bandage, safety pins, disposable sterile gauze, tweezers. Okay, so what do you mean by crepe bandage? Sprain, if somebody is having some fracture in the leg, so you have to immobilize that area. If mobilization is there, the problem will rise. So that's why crepe bandage, triangular bandage. Okay, you have seen if somebody is having fracture and the hand will be in that area, in this mood. Okay, why? This is anatomical position. In this way, there will be no problem in the hand. Okay, so they will make the hand, if in the accident somebody's hand is going there in that way, but you will make it come closer in the body, and then you will give an crepe bandage or triangular bandages like that way, and then send him to the hospital, and then specific orthopedics doctor will see, and that will give the definite treatment. Understand? What are the 3 main procedures for first aid? Doctor ABC. Okay? D for? Loudly speak karo every time. Danger. R for? Very good. B for? A for? B for? C for? Very good. इतना बोल दोगे तो पास कर जाओगे. Why are first aid procedure important? I have discussed in the introduction part, in the very early phase of my lecture, what is the importance. Okay, in the rail, train, bus, in the road, in the anywhere, in the jungle, anywhere, snake bite, earthquake, railway accident, road traffic accident, drowning, everywhere first aid is very important, because hospital can't go there. You person can go there in a team, in a small team. So recently in our state, the floods, after a very long period of time, very big flood has been occurred. Okay, lot of district has having lot of troubles. Doctor, first aid teams with medicines, with all the kits, salines, bandage, everything they gone there in a small teams. Okay, one doctor is there and person is there. Government had sent there, and with the some foods. So this is first aid, na. Any IGM hospital or GB hospital can't go there. The buildings can't go there. But patient have to come, na. In the Bilonia side or Sunamura side, it's 100 kilometers away from the Agartala. Okay, the travel distance is more than 2 hours. So at least some treatment must be there, na. So in the flats, first aid kit has been reached there. This is the importance, and this is the explanation of this slide. What are the 8 steps of the first aid? Okay, it's an arbitrarily divided 8 step. If you can make it 10 step, no issue. Okay, so John is passionate about first aid and believes everyone should have the skills and confidence to take action in emergency situation. Okay, so in any hospital, in an emergency, there is an emergency consultant. Okay, so he is also knowing the first aid. Okay, in the emergency, if after accident patient will come, he will give the first aid, then definitely treatment will arrive. And whenever somebody is go outside from the hospital, they is also give the first aid. Okay, so there is no limit of the first aid. What I told you, in the developed country, after 5 kilometers later, they are wait for the disaster. Anything happens, they will go there within a 5 minutes, 10 minutes. With a big car, with the teams, everything is there. Okay. So these responses are the conscious: breathing, pulse, bleeding, shock, fracture, burns, consciousness. Concussion, head injuries, means earthquake, somebody is having head injury, somebody having road traffic accident, bike and car, okay, then without helmet, they will have some problem in the head. So if somebody stuck in the head, inside your skull, this is skull, okay, inside your skull, there is brain, which is a very soft part, okay, that will shake like that. And within this shaking, the blood vessels, which is connected with the skull base and with the brain part, it will tear up and the bleeding inside the brain. And you have to do the CT scan, but in the periphery you will not have the CT scan, but you can write patient is needed a CT scan, okay, for the head injury. What is first aid in emergency? First aid sometimes referred as an emergency aid in the first killed hospital. In hospital also first aid concept is there. On the occurrence, accidents and sudden illness is ordered to preserve life, prevent further injury, relieve suffering until qualified medical care is available. Last line. You read the last line. Means whatever you are giving for the temporary treatment to save the life until the medical team or you can send the patient to the definitive treatment area. The golden rule of the first aid. Do first thing first, quickly, quietly, and without fuss or panic. If doctor comes under panic, then the khelai shesh hoye jabe, tahle ar kichhui hobe na. So you have to cool and calm, and you can keep your mind very peaceful. But you can't cry in front of that injured area. You will give the treatment. You are a doctor, okay? You are here to save the life. Okay. Give artificial re-preparation if breathing has stopped. Artificial re-preparation. The spelling mistake is the artificial respiration. Okay. Somebody has seen the ambu bag or not? Ambu. In the films, you have seen a bag like this, and that is put it in the nose with the mask, and somebody is doing and squeezing the bags. Squeeze, it will fill up, then squeeze. The oxygen will go there. This is very simple way to
increase the oxygen in the body. This is very simple way, and it is very effective also. And it is very simple things. You can keep it in your bag also. 5 minutes. I will take 5 minutes. ঠিক আছে? Do not allow people to crowd. After accident, lot of good person will go and see what happens, but they are not doing anything. That should not be happens. Your team is there. Side them all and give your work there. Okay? Do not remove cloths unnecessarily. That is actually total stigmata. Arrange for removal of the casualty to the care of doctors or hospital as soon as possible. You call the hospitals to send some ambulance. Okay? You can bring the patient nearby hospital. Like if the accident happens in Bishalgarh bypass, you put the patient or take the patient to the Bishalgarh hospital. They will give some treatment, and then from there, patient will send back to the GB hospital. Also, first aid, preserve life. What is the importance? Prevent deterioration, promotes recovery, taking immediate actions, calming down the situation, calling for medical assistance, apply for the relevant treatment. All these things, what has been written, will be fully applicable whenever you will trained. If you know how to do the ambu bag, if you will know how to do the channel, if you know how to give the saline, then actually your team will work properly and good. If you will panic and you are not understanding and you are not well trained, then the proper care and proper triaging and proper treatment you can't give. Okay? Our profession is not like an engineers or IT professionals. You will sit in AC room and you will do in the computer everything. Work from home for doctor. Work from home concept is not there. You are going to be a labor. It's a highly qualified labor. Okay? Your hand will have some gloves. Somebody will doing surgery. Somebody is doing bandaging. You will see the blood. You will see the cry of the patient. You will see the cry of the patient relative. You have to behave like a good professionals in that situation. Okay? Tough job. Any questions? Nothing? কেমন লাগলো? তোমাদের সাথে আমাদের অনেক পরে দেখা হবে। আমি তো মেডিসিনের ক্লাস নেব আজকে, তো এমনি জাস্ট একটা সৌজন্যবোধ ক্লাস নেওয়া হলো, অ্যাজ মেডিকেল কলেজটা শুরু হচ্ছে এখানে। ফার্স্ট এড ক্লাস, অ্যাটলিস্ট কিছুটা তো মেডিসিনের পার্ট এখানে আছে, দ্যাটস ওয়াই এই ক্লাসটা আমাকে দিল আর কি। আরও ক্লাস হয়েছে তোমাদের? আরও ক্লাস হয়েছে তো এর মধ্যে? কি কি ক্লাস হয়েছে? লাউড লাউড লাউড, এখানে কেউ কিচ্ছু বলবে না তোমাকে। ঠিক আছে, আজকের জন্য ক্লাস শেষ।